I understand that the following information will be gathered and utilized for educational purposes by an Indiana Wesleyan University student. I give my permission for this information gathering and physical assessment to be filmed and posted for access by faculty and students at Indiana Wesleyan University. The video will be deleted by the student as soon as it has been reviewed and graded. I further acknowledge that this is for educational purposes only and that the information is not meant to be diagnostic. Therefore, Indiana Wesleyan University, the faculty and staff, as well as the student, are not considered liable.
Hi, I'm Mike Torelli. I'm going to be your nurse, and with your permission, I'd like to ask you a few questions and do a little assessment on you.
Sure.
Okay, so what brings you to the office today?
I haven't been feeling very well lately. I've been very tired, and I seem to be kind of short of breath.
Okay. How long has this been happening?
Well, I sort of felt like this before I had my heart attack and I had that heart procedure. I had those stents put in.
Okay.
And then I felt pretty good, and now it seems to be maybe about 2 weeks that I noticed that I started to feel tired again and more short of breath.
Okay, and have you been having any other symptoms with this?
Well, I've been having some chest discomfort when I'm doing certain things.
Okay. What does the chest pain feel like?
Well, it's not pain exactly. It's more heaviness, like just this heavy feeling in my chest, and I feel more short of breath and just real kind of tired and weak, and then I sit down and wait, and then it goes away.
Okay, has the pain traveled anywhere to your neck, shoulders, arms at all, or?
No, it just stays pretty much right here.
Okay, and I see you have a prescription for nitro. Have you been tempted to take any nitro for this chest discomfort?
Well, I don't like to take the nitro because it makes me feel very lightheaded and kind of dizzy, and gives me a really bad headache. So I just find that if I just sit down, it passes.
Okay. You said you've been fatigued. Have you had any trouble sleeping during the last couple of weeks?
Kind of the last few days. I've noticed that I wake up after being in bed for maybe 2 hours or so, and then I feel like I can't breathe deep. It's like hard to catch a deep breath. So I've been getting up and going into my living room and sitting in the chair and propping my feet up. And then I end up falling asleep there after a while, and I sleep pretty good.
Okay, so it's very uncomfortable for you to lay flat on your bed.
Yeah,
okay.
Yeah.
What about your appetite? Have you been had any appetite?
My appetite's the last week or so seems like it's not as good as it usually is. So I've been trying to eat light, and I've been eating more canned soups and things like that, just light foods.
Okay. Do you weigh yourself regularly? Have you had any weight gain or loss?
I haven't. They did mention, I do remember, they did mention I should be weighing myself. But I haven't been doing that.
Okay. Have you noticed if your clothes been any tighter or looser, or?
Well, my clothes don't seem to be much different, but my shoes seem to be tight lately.
Okay. And it says here you're a 2-pack a day smoker. Are you still smoking?
Yeah, I am. I cut back. I did pretty good cutting back after my heart attack, but yeah, I think I'm back probably close to about 2 packs a day.
Okay. What about your medications? Are you taking them every day?
Well, there's that one blood pressure pill. What's it called?
Metropolo?
Yeah,
Okay.
that medicine. And sometimes I think it makes me a little dizzy. I think that metoprolol makes me a little dizzy, so sometimes I don't take that. I haven't taken it for a while.
Okay. All right, I'm going to take your vital signs and give you a little physical assessment here, okay?
Okay.
All right, well, your blood pressure looks good, but your heart rate's a little fast and your oxygen is not satting very well. Okay?
What does that mean?
That means you don't have enough oxygen going through your blood to keep your cells healthy. All right, I'm going to listen to your heart and lungs now. All right, could you hold your breath? I'll hold your breath one more time. Okay, your heart sounds good. All right, could you open your mouth and take a deep breath? All right, it sounds like you have a little congestion in your lower lungs. We're going to have you lay down here on this bed. Okay, listen to your heart one more time. And let me check your. You face this way, and I'll check your neck. Okay, now face the other way. All right. Your abdomen and heart sounds good. Your heart's a little fast, but the rhythm is good. I'm going to palpate your liver here. Don't seem to have any liver distension, which is good. Mm-hmm. Okay, I'm going to check your feet and just make sure, check for any edema here.
Mm-hmm.
Okay, you have some edema in both legs. Not real bad, but we'll figure something out to work on that. Okay, and we will sit in the office and we'll get back to you in a few minutes. Okay.
Okay.
How do we stop it?